thing where an NGO, a microfinance company, work with vegetable vendors. So if a woman who goes in the morning, she buys the vegetables and she takes this small loan, buys the vegetables, pays it back in the evening and gets ready for the next day. If she has to go to see a doctor because she has a fever or a headache or even a personal gynecological problem, she will spend 4 to 5 hours of the day seeing the doctor, waiting in the line, doing everything. She doesn't mind paying the 100 rupees. But she will lose her income of potentially 400, 500 rupees and therefore may not be able to feed her children that day. So we put a small telemedicine into the microfinance office and this NGO enabled that. So now a lady, when she comes in 15 minutes can tell the doctor, this is my problem, this is what I need to do. They either give her the solution, or if it's serious, then they tell her, now you do need to go and see a doctor, don't put it off. Because if you waste more time, it could become more serious. So it's the small things like this which give a lot of satisfaction, and that's why I love working in healthcare. Many years ago, I actually heard a talk, not by Bill Gates, but by Bill Gates' father. And he said, and at that time we didn't, so much fully understand the meaning of it, but he said healthcare will be transformed by the 3 Bs, which is biology, bytes and bandwidth. Biology, the day the genome was deciphered, we understood why a certain individual gets disease, what type of disease, why their response to drugs is different. We are still in the process of figuring out which gene and which gene expression links to which behavior, but the journey has begun. This journey has been enhanced by the 2nd B, which is bytes. As per Moore's law, the computing capacity and the price of IT has moved in this inverse relationship, enhancing capacity and bringing down cost of computing, and thereby we're able to take all this complex data and make meaning out of it. And the 3rd B is bandwidth. It is that bandwidth which is connecting rural India, which is making mobile telehealth possible, which is allowing a doctor from Apollo to talk to a patient in a village in Africa and tell them, what their diagnosis needs to be or what their next steps should be. So it is a transformational, globally transformative. I'm happy that adequate emphasis is being given on keeping the cost of digital empowerment low so that we don't create 2 worlds of the haves and the have-nots. And in healthcare, at least at Apollo, we're able to use this capability very much in rural India, very much in underserved populations. Any great institution is guided by a driving force and then a principle. And our principle was really, how do we bring healthcare on international standards within the reach of people? So everything that we did was towards that goal, and it was built on kind of the ideology that Indian doctors are capable of the best in healthcare. We need to give them the infrastructure and the management teams to help them bring out that best. It was built on the fact that we strongly believe that Indians deserve the best of healthcare, and they should be able to get it at their doorstep and in their hometown and not need to travel for it. So that was really the whole principle or ideology of Apollo, which was conceived by Dr. Reddy, my father and our chairman. And he was really the guiding force who kept that vision in front of not just 4 of us as his daughters or his family, but in front of everybody. So even the housekeeping boy feels that he's doing something very noble. He's not cleaning a floor, he's preventing infection control. The maintenance knows that their air conditioning is enabling a theatre to run and therefore lives to be saved. So it's keeping this ideology and mission in front of everyone so that it's a common team of inspired individuals moving towards something which is larger than a daily purpose. It's a mission, not a means of living. For any successful initiative, you need a guiding force and a guiding principle. So the principle was very clear: find a way to bring healthcare of international standards within the reach of people. So it was about national pride and our faith in the ability of the Indian doctor. It was about the fact that Indians should not be denied good health care. And so that was a very compelling scenario. And the force was really Dad, Dr. Reddy, our chairman, who would leave no stone unturned, not waste a single second or a minute towards pushing towards that goal. No detail was too small for his attention. I actually have worked in almost every role or every part of the hospital. I started out almost 30 years ago helping the ward secretary. I've worked in food services, I've done stores, I've been in reception. So it's exposure, and hospital is really the main passion for me. So when I worked in family health plan or helped to promote that, that was because we needed an insurance mechanism in the country. And we realized that the second largest reason for indebtedness in our country was because of health reasons. And people were pawning their wife's jewelry or selling their land to get a medical treatment done, and this was very painful. I also think that having this larger philosophy and ideology helps my sisters and myself think about this not as a business, not as a job, not as a shareholding, but as a responsibility to the healthcare of India, and at some point of time, a little bit of global citizenship, because we do get patients from over 120 countries. And they're coming while it's good for the balance sheet, it's very good for the Indian pride to say that people seek us out. They have international options, but they choose India as their destination of choice. They choose Apollo as their first choice when they're planning where they should go for healthcare. And these are kind of principles and philosophies that we've built upon to really be the primary driver of all our actions. And we knew that we could not fund 1.2 billion people, whatever subsidies we did, however much we raised in a foundation, and that insurance was the proven model for global access to healthcare. And so building on that, I was an FHP. I went into a little bit of detail on one role, because I think each of these roles and each of the companies that we have are based on some kind of ideology which is address the Indian need, fill the gap in Indian healthcare, and if it's not there, find a way to go and do it. And so whether we started nursing colleges because there were not enough good quality nurses, or we did IT companies, we did telemedicine to bring rural access. Rural telemedicine is something which started in Dad's village 16 years ago. In the village of Aragonda, we started telemedicine, and we were fortunate that when President Bill Clinton was visiting India, out of high-tech city, he pressed the button which connected Aragonda, a small village in Chittor, with Apollo Hyderabad, where we are today, and the cardiologist viewed the echo of a young girl and told the mother, she has a hole in the heart, we need to operate, bring her to us during her summer holidays, and she will go home in a few days and lead a normal life. And luckily by God's grace, that's exactly what happened, and she's now graduated from school, this young girl who we operated upon almost 15 years ago. But the ability to diagnose, so this doctor didn't need to go to the village, the patient didn't need to come here. So from that time to today, we've done over 400,000 telemedicine interventions. We've reached out to hundreds of locations. We've set up our own telemedicine stations. And today, by an inspired move of the government, we're actually working with the government in over 60,000 locations to bring medical second opinions and medical clinical care to these villages at the rural level. So the potential of the reach is enormous. And then there's the empowering capacity. You put a tablet in an ASHA worker's hand and you've changed the knowledge base. You connect a record, a health record, and you do a back-end analytics. You will improve the type of diagnosis and the type of treatment being done. You put a personal health record on your mobile phone and you can monitor your own diabetes. You create in this beautiful thing of Internet of Things, you do a connectivity between the glucometer, your personal health record, and a medical enabled call center, and you've improved the way diabetes is being managed. Because today 50% of Indians who have diabetes don't know they have it. Of the 50% who are diagnosed, almost 45% of them are not in compliance. If you can change the way they're monitoring their diabetes, you will prevent multiple downstream complications of diabetes, which includes heart attacks, strokes, loss of limb, loss of eyesight. So there is so much that we can do by creating an IT-enabled healthcare environment. So at the high end of it, you can send a drone with a life-saving drug and save a life. You can connect the ambulances into the emergency room so that on the way people are being treated. There are hundreds of use cases. IT is what will enable us to create scale, replicability, ensure quality, bring down cost, and enhance reach. So all these are, they're not role-based, they're not business-based so much as need and philosophy-based, with the philosophy being fill the gap, fill the need, ensure care. So those are how the roles evolved. Shall I call it romance with IT, or just this deep passion with IT began many, many years ago. I'm not an engineer myself, but I did realize that healthcare and hospitals are one of the most complex operations. We have all the complexities of a hotel. People check in, they stay, you need housekeeping, you need food services, they check out, you need to bill them. You have added complexity of human lives. But now IT has gone many dimensions beyond. If you look at the analytics capacity, I'm happy to share that, just about 10 days ago, I got a call from the global head of healthcare of Microsoft saying that we won the Innovation Award for the best use of IT at the Apollo Hospitals team, because we created an analytics algorithm using a Microsoft tool which reviewed and it was able to predict what was most likely the best antibiotic to use. Things like this are so exciting because it's not a matter of I use technology. It's a matter of and not even a matter of okay, I saved money for the patient. You potentially could have saved a life. You've potentially removed suffering or reduced suffering. And that's how I think the IT journey is what I briefly kind of described as a romance, because you really fall in love with what you can do with IT when you use it in the right way. The Eureka moment in treatment of healthcare used to come in the 5th and 7th year of medical school. Those Eureka moments are happening in the 2nd and 3rd year of medicine. And I think that's one of the biggest transformations. I also believe the huge lack of quality teachers is getting to a degree supported or helped by the fact that we can standardize content. And also that the classroom is really not the only place of learning. Because of the mobile phone and this just ubiquitous access, you can learn everywhere, anywhere, any moment. And I believe that therefore learning over a period of learning is becoming like a part of our nature rather than a formal environment that you go to. And that is possibly the biggest transformation happening in education. The body is not just the body. It is the body, the mind and the soul and the environment and the food we eat and the biomes that we're nurturing. So I think that this kind of conscious appreciation of the fact that it's not only allopathic medicine and it is the whole environment which appreciates healing. So pranic healing and our move towards that is just one step towards this overall appreciation. Sometimes a mother's hand or the encouraging word of a friend can have as much impact as a painkiller, if not more. So I think that it's very important for us to appreciate that. And why not give our patients and the world the benefit of this holistic view. It doesn't mean that we believe less in allopathy or medicine or science. In fact, I think we believe in it very, very strongly, but we want to add on to it, enhance its capability. And so more than the belief in one line of medicine is the belief in the need to make human beings feel better. I think there have been a lot of stories, lots of them, but I'll share one which is kind of quite personal. My mother-in-law, 83-year-old lady, the day after Diwali, walked next to a diya which was on the ground. Her cotton sari caught fire and she had a 60% burns. Even though we got to her in minutes, this cotton sari just picked it up. And so an 83-year-old lady with a 65% burns has an under 15% chance of survival. She got the best of medical care. I mean, we put her in a room with a laminar flow. She had zero infection. She had doctors. She had appropriate nutrition. She had everything. But she also had the other dimensions. So there was pranic reeling, there was spiritual prayers, and she had her family with her. Today she's at home leading a fairly normal life, and I know that besides the medication and the immunoglobulins, that there was a lot of prayer going on, and that did pass on those positive energies. I don't know whether you can only do pranic healing and not do the science. But I definitely know that other elements enhance the good work of doctors. First, I think, we need to separate religion from spirituality. We are a very, I won't say secular organization, but we really have representation across all groups, all religions, all beliefs, different cultures, people from different parts of the country and the world, and we want everyone to feel comfortable and be able to give their best for that patient. Coming to what binds a team, I think that if there is a mutual respect, irrespective of religious or beliefs, and if you've reached a certain higher goal, so when the common goal is not I'll reach 100 crores turnover, but when the common goal is that I will positively impact healthcare, then the goal itself is kind of spiritual. Because spirituality is about, in my mind, is about reaching out and touching another person. It's about humanity. And when spirituality and humanity are together, and we're blessed that at Apollo it is about helping another human being, then everything it fits nicely together. You don't need the words or the names to put labels on things. You only need the belief and the passion and a smart and efficient organization to enable this belief and passion. I would say you need to be more self-aware to be a better leader. Maybe through self-awareness you discover the leadership within you. But I think there are a lot more dimensions to leadership than self-awareness. So,
what are the dimensions that you relate?
So there are all kinds of leaders in this world, and we've seen leaders from Hitler to Gandhi, and from a pure leadership context, I think both of them were successful. But leadership comes from a certain passion, and I think an ability to see something that the other person doesn't. And when you see that and help the rest of the team see the same as you, believe the same, and then create or enable that, that is what leadership is about. So then leaders come in all kinds of shapes, sizes, belief, methodologies. There are powerful leaders and there are soft leaders. But each one of them is seeing a different lens and sharing that new lens with others. That's just a thought. What is fabulous is when you get appreciation. If somebody calls and says, only Apollo can do this for us, please find a way. That gives me a purpose, a responsibility, a mission in life. And those are far more consuming and fulfilling than any materialistic stuff that you can get. We would not have been where we are without the blessings of so many patients who continue to say thank you, and who feel that we did go slightly beyond what is the typical corporate hospital, because there is a belief throughout. So that's how we've tried to live our life. It's everything we try to do, whether it's the yoga or the books we read or the friends we seek out or the activities we're trying, is in response to what our mind is seeking. So I think it was Carl Sagan who kind of said, and my husband shared this quote, that we can judge the progress we're making. So that progress, whether it's in the boardroom, it's a company, it's a politician, or it's an individual in their spiritual journey. So you can judge the progress you're making by the courage of the questions you're asking. So am I asking myself the right questions? So the courage of the questions you're asking and the depth of the answers that you're seeking. You're beginning to seek deeper meaning, more answers. You want to meet a different type of people these days. So it's people who are impacting society, people who are appreciating that there's another dimension in the world, and everything is not the black and white of numbers and balance sheets. So so maybe people don't know that I love adventure sports. I've been paragliding. I've done, I want to go deep sea, swim with the sharks kind of thing. I love water. So there are a lot of things to do, a lot more to be done. But I do love adventure sports.